this bill primarily goes to being about is reducing the penalties associated with people who may be fined or charged by the police for having drugs of dependence. What our government is doing is making sure we put in the support services for rehabilitation. So like I said, residential rehabilitation beds.
Some will argue, well, a small bit of dope on possession is fine, and we know that the police put in diversion programs and cautionary notices, and they do that now, and they do a tremendous job in trying to support young people who've got some of these drugs on board to steer them in the right direction. And more effort should be put into that, not just doing what this bill does, and that is to open up and allow any drugs to be in small amounts to be decriminalised.
The criminal justice response to drugs simply does not work. Indeed, the current approach is exacerbating drug problems by draining funding from effective health and treatment services, clogging the criminal justice and correction systems with non-violent offenders, and maximising the health dangers of drug use. While drug use is endemic across all corners of society, policing drug use disproportionately focuses on certain public areas. So we see drug dogs outside music festivals and searches of young people around public housing, but not wealthier people at horse racing or celebrities at the Logies.
We're not in a position to support Ms Patton's private members bill in its current form today. However, we do want to support further work being done in this space. The government will convene a working group with police, health professionals, addiction specialists, youth workers amongst others to give advice to the Minister for Health and the Minister for Police on possible infringement trial options.
The ultimate goal is to legalise all drugs in the state, and indeed to normalise all drugs in the state. And that is today, what we're debating today is just another step along the path toward that. And that's a step that I hope and I don't believe we should take.
The cost of policing, sending people to the court, this is for possession offences, and then imprisoning them for those that end up with a prison sentence. According to the Parliamentary Budget Office and the data that we have, over 10 years, this costs somewhere in the order of $936 million over 10 years. So approaching $1 billion over 10 years. What an incredible waste of resources.
We as a government more than doubling the number of residential rehabilitation beds. We have invested a lot of money, $23.2 million alone in the 2021 and 22 budget to deliver funding for residential rehabilitation across the state.
Over many years, the Liberal Party has been highly supportive of methadone programs, of needle and syringe programs. These were things that the Howard government many years ago funded to a very large extent. Of drug courts, for example, of a variety of other measures that the current government has continued to support, as Dr. Q has said. And so for those reasons, despite Ms Patton's excellent intent, I won't be supporting this bill either.
Despite what's bandied around here sometimes, the police do a wonderful job in protecting our communities, keeping them safe, and they're very professional in what they do. We won't be supporting this bill, but we would implore the government to get serious about investing in alcohol and other drug rehabilitation and all its associated support mechanisms.
When we inherited or came into government at the end of 2014, there were 208 beds in terms of residential rehabilitation, and that's more than doubled to over 500 beds, of which the increase, almost half, is in regional Victoria. In our most latest budget, we've delivered a funding of $23 million to operationalise new alcohol and other drug residential rehabilitation beds in Corio, Traralgon and Wangaratta.
I understand drug use and possession is multifaceted and that many of these people need help. However, our children should not be exposed to this like it is some type of normal. I feel strongly that decriminalising drugs sends a message to the community that there is no real consequences for this type of behaviour, when in reality, the impacts of drug use are far-reaching and affect the broader community in a number of ways.
Any rehabilitation program, that is, it really only works successfully when a person actually wants to be rehabilitated. What will indicate non-compliance under this bill? What if the person involved fails to make progress and relapses quickly? Is it back to the criminal justice system, or back to paying the fine and no further treatment? This all needs further refinement.
What is clear is that drug education, treatment and rehab programs are overwhelmed in the Victorian area, and wait lists occur up to a year, and that was before the pandemic. There's simply no capacity in the drug and alcohol support sector to provide additional drug and alcohol education and treatment programs by this bill's proposed commencement date of 1 July 2022.
I'll be supporting the bill because of a young man in my family who died from drugs. He didn't have the opportunity where he could get the support where he needed. And when I say he was a young man, he wasn't a young man, he was a boy. And I will support this bill, and this is something that we really, and I thank Ms Patten for bringing it forward.